We got Dr. Kumar in the house this morning, styling in his Austin FC scrubs. Looking good.
Yeah,
going to the match tonight.
That's right.
Yeah.
FC Dallas. We gotta score some goals.
Yeah. Well, let's talk about the study here. If you're lonely or socially isolated, you might have a higher risk of early death. This is according to a new study published in the Nature Behaviour Journal. Dr. Kumar, talk about how this study, first of all, defines social isolation and loneliness.
Yeah, that's good. That's a very good question. So social isolation is where you can objectively qualitate that a person is isolated, does not have social contacts, lives alone. Whereas loneliness is not so easy. It's a subjective feeling of poor social contacts, poor social relationships, and it requires a person's own definition of that. Whereas socially isolating is easier to objectively measure.
Yeah, so early death, that's pretty big. So this must be having a big effect on our bodies.
Yeah, you know, so it's interesting. The study is a meta-analysis. What that means is not just one study, because one study, how do you measure anything? How do you get close to the truth? But this study is about 2 million people. It's a study based out of China in which they looked at studies that had already been done, about 90 studies that encompass 2 million people, and the follow-up is as little as 6 months, which doesn't give you an accurate idea, to some studies as long as 25 years. So if you put them all together, you start approaching something close to what was probably true. And what they noticed is that if you just look at all-cause mortality, people that are socially isolated have a 34% increased risk of all-cause mortality compared to a control group, people perhaps such as ourselves, and people that are just define themselves as lonely, still higher, 14% greater risk of all-cause mortality, but not as great as those that are socially isolated.
Yeah. So what does this say? We need human connection, basically?
Yeah, you know, yeah, it does. It tells you that, but the question begs is like, why? Like, why does this do that? And there are several theories as to why. You know, for the people that are socially isolated, they feel like maybe those people are probably smoking cigarettes more often, probably drinking alcohol more often, and if they need access to health care, that they don't have good access to health care. They can't, nobody's around to help them seek medical care for diabetes, high blood pressure, those kind of things. Getting to health care might be difficult. Now, what's harder is people that are lonely. They aren't necessarily isolated. They might live with other people, but they're self-described. And so there's a theory that prevails that it could be chronic stress, that people that are isolated and lonely have an increased abundance of stress hormones that you and I might have during periods of stress, which in other studies for decades have been shown to perhaps suppress the immune system, perhaps cause some other problems that cause increased vascular disease. So the theories abound. Nothing can be proven, but there's numerous theories as to why these people that are isolated and lonely are having increased cause of all-cause mortality, but certainly it appears to be true.
Yeah, so I guess it's more like the other conditions associated with being lonely than being actually lonely.
Absolutely right. You know, I mean, all of these things have a neurochemical mechanism. There is a way from point A to point B that involves science and chemicals and things that happen to your body that allow it to deteriorate at a different rate than people that don't have these conditions. So certainly, you know, the good news about that they can be affected, you know, so what it tells us is not to ignore these feelings. If you yourself or a loved one is feeling lonely, then we need to help and, you know, get help for those people. It comes on the heels of the U.S. Surgeon General's report about loneliness and social isolation just a few weeks ago. And Vivek Murthy, our Surgeon General, you know, said he himself was lonely at times during the pandemic. And coming off the heels of the pandemic, this is more of a prevalent feeling. And so for us to not take these emotions lightly, they can affect your health, and to intervene if you can. And also friends, neighbors, families, people that are socially isolated, perhaps we should reach out to them and see if they need anything, if they need access to health care, that they're checking in on these people every once in a while might actually help their health.
Good advice, as usual. Dr. Kumar, thank you so much. If you got a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. You can check out his website, drkumar.com. We'll be right back.